It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, folks, how many of you have knee pain, shoulder pain, elbow pain, and you have all these arthritic problems, or you're having some serious problems with your knee or your hip, and you're saying, someday I'm going to get to an orthopedic surgeon and I'm going to get this taken care of. Well, maybe after today's show, you're going to understand that there is an opportunity for you to feel better. My guest today, a very good friend of mine, has known the family for many years, great guy, Dr. Tony Falvello, who is an orthopedic surgeon, and I'm so proud to have him on the Sam Lesante Show today. Tony, how are you?
Good, thank you. How are you?
I want to ask you one question, Tony.
Sure.
Is your dad taking care of you?
Oh, good care of me.
Are you sure?
Yeah, always.
Because he can be a little tough once in a while.
Yeah, no, he's a good guy overall. But
now, I'm so proud of you because I was talking before the show with your lovely wife, and we're talking about the fact that, remember when you were a little kid. Now, the Falvellos, okay? There's attorneys, there's a dentist, there's, now an orthopedic surgeon. A little bit about your childhood. You were born in, tell us a little bit about yourself. People who don't know you.
Well, I grew up here in the Hazleton area. I was the fifth generation, actually, in my family to be here. And most of you know my family because we've been lawyers in the area for many years. And my father continues that tradition, and so does my sister. But that just wasn't for me. So early on, I got interested in sports, athletics, and medicine, and decided to go down that path and ended up being an orthopedic surgeon. It's really a dream job for me. I love showing up at work every day, and I just really enjoy what I do.
I don't know of any Falvello who doesn't have a passion for what they do. Now, I know you have a passion, but it's interesting because why did you decide, when you went to Penn State and then you went to med school, but why did you decide to go into orthopedic medicine?
Actually, I got interested in orthopedic medicine quite some time ago. I was in high school and I was participating in sports. I was fortunate enough to play on the basketball team at the Hazleton Area High School back in 1993. We made it to the state championship. That was a heck of a trip and a good time for the community and everybody involved. It really kind of brought everybody in for the new high school. And I watched a doctor, Dr. John Lease, operate at St. Joseph's Medical Center when I was in high school, and ever since then I've kind of been on that orthopedic track, and I've been very interested in orthopedics, and just, I was fortunate to get here.
It's like anybody who is in any kind of profession, Tony, if you're looking at whether you're going to be a lawyer, whether you're going to be an artist, or whatever the case, I mentioned that word passion because that's so important. Now, your education. Let's talk about your education because I have a lot of other questions I want to ask you.
Sure. I graduated from Hazleton Area High School. I was the second class in 1994. I went on to Penn State University. I finished in 1999. Did my medical school at Osteopathic Medical School in Philadelphia, which many of the doctors in this area went to, and they were very supportive of me when I was applying there. And then I did my residency at Pinnacle Health System, which is also a place that many doctors in the area did their training. And through that, I was fortunate to get some really good quality training there. We were a 2008 and 2009 top 50 hospital for orthopedics.
And that's the thing I was going to mention. The fact that you were at Pinnacle, which is in 2008, 2009, the top 50 orthopedic hospital. And then at Atlanta, the Children's Healthcare of Atlanta, and also Hershey Medical, these are the nationally known orthopedic hospitals.
They are. Children's Healthcare was ranked 5th in the country for pediatrics at the time I did my rotation with them. And I saw some things that I'll never see before. Unbelievable technology and unbelievable procedures. And even though we can't do those things here in Hazleton, it's good to have a knowledge of them. So, you see that patient that may need something like that, and you know where to send them. At least you're aware of it. And it's been very helpful.
You were telling me about the fact that when you were interning, and that you've seen so many different things. What were some of the, I'm sure they're all interesting, but what were some of the interesting surgeries that you were participating in?
Oh, well, we'll see all kinds of things. And, it's medical training is nothing like Grey's Anatomy or, ER. I mean, everybody watches TV and they said, oh, it's like that. It's very hierarchical. But, you do see some things that are really fun and interesting. One of the things I remember is, we would do these corrective spinal surgeries in Atlanta. They have a robot that does the surgery for you, and it's accurate within 1 millimeter as to where you can put a screw in somebody's spine. And that sounds horrible, but it's really important, obviously, to be in the right place. And that kind of technology is just amazing. What's coming down the line in medicine, technology-wise, and especially in orthopedics, is really impressive.
Yeah, and that's the exciting part. I opened the show and said, how many people are out there who are suffering from knees, and who wants to have a surgery?
Right,
But that's
right.
the point is, what's available today and the technology that you bring, okay,
Right.
from the the spinal people, at one time don't even touch my spine.
Right, right.
And I mean, there's always a risk. We're not going to lighten that up,
Of course.
but you've seen a lot in the spinal, and you sort of like specialize in that area.
I do like spine. I haven't done a whole lot of spine surgery here today, but it's because of resources within this area. But I do see all kinds of patients, and spine patients are a big part of my practice. And there's a lot of new things coming down the line in terms of spine surgery that hadn't been offered in the last 20 to 30 years that get people moving sooner, get them feeling better quicker, and it's a really impressive field of orthopedics in terms of technology and what they can do now versus the old days, which was always decompress, take pressure off the spine, and fuse. Now there's technology coming down where we're trying to preserve motion in the back and do those sorts of things, and it's very promising.
All right, now so you go to the school, you're top in your class. And now you decide. I know you're born and raised in Hazleton, and many people say to me, especially my friends that come from New York City, they say, "What are you doing here? How come you're not in Allentown, Philadelphia, etc.?" Because really, my studio should be in those areas for what we. And I'm not being braggadocious, but what we produce, etc. But the point is, I'm proud of this area. Okay,
Right.
so here's Tony Falvello, orthopedic surgeon, successful intern. Why come back to Hazleton?
Well, because just like you said, I'm proud of this area too. I had a wonderful childhood. I was very fortunate to grow up here, and I believe in the people here. I think they're good people, and they deserve access to quality care just like everybody else does. And for so many years, particularly in the last 10 years, we've seen so many surgeons come and go here orthopedically. Somebody goes to them to get a knee replacement done, and a year, 2 years later, that surgeon's out of town. I mean, why should it be that you have to go to a major medical center to get a knee replacement? We could do those things and do them very well here. And a lot of the patients are very successful. And I think there's this overall attitude that maybe I have to leave town to get quality care. That's just not true.
We mentioned not only knees, but the other areas of that you are doing surgeries are. What other areas are?
Oh, I do all kinds of surgery. I'm a general orthopedic surgeon. I don't focus in any one particular area. So I do the most common things that we see in orthopedics, which is 90% of what's out there: rotator cuff surgeries, hip replacements. I do certain elbow surgeries, a lot of carpal tunnel, hand and wrist surgery as well. Also, knee arthroscopy, sports injuries, and trauma. Unfortunately, we have an aging population here that quite frequently falls and breaks things, and they need surgery.
And it's so good to know that you have them there. Folks, if you just tuned in, you're watching the Sam Lesante Show. My guest today, Dr. Tony Falvello. Anthony Falvello is an orthopedic surgeon. Falvello Orthopedics, affiliated with the Coordinated Health.
Yes,
okay?
yes. I'm working on that.
And the phone number, here's the phone number if you want to call for consultation, 861-8220. Tony comes with a lot of experience. And, when you have doctors like you who come in, and I've said this for many, many years, since I started here in 1994 with my shows, we are blessed with the number of doctors we have in this area. I mean, guys like you and women who come into this area have tremendous amount of experience. And if they only realize what they have here, and they think they're going to the other cities, they ain't getting what we have here.
Right.
With that being said, okay, you're opening up Falvello Orthopedics, okay, with the Coordinated Health System. Some of the areas, what new opportunities, do you bring to the area?
Well, the affiliation with Coordinated Health allowed me to bring things to this area that Coordinated Health can do that we can't necessarily do here. Basically, when I transitioned into Falvello Orthopedics, and now I'm working out of the Coordinated Health campus at Hazleton, I have opportunities to quickly and easily refer patients for needs that we can't fill here, and also it gives patients an option if they would like to work with me, but they necessarily don't want to just have their surgery done at one particular place, which in the last 2 years I had to do that at Hazleton General, but now they have options.
Now, it's so difficult sometimes for a person to be convinced that they don't need to be, they do not have to suffer with a rotator cuff or shoulder injuries or spinal conditions or hip fractures or my hip is bothering me or my knees bother me. Why is it so important? And folks, listen to this. We've been telling this for years. Why is it so important that when you know you have a problem, to address it early?
Well, because you don't have to suffer. You know, your quality of life doesn't have to suffer. And I've been through this with my dad. Unfortunately, he's had a lot of orthopedic surgery recently, you know, but his quality of life improved significantly from that. So you don't have to wait until you're limping, until you can't walk a block or you can't get around the grocery store to come in and get something done. And, you know, if you have shoulder pain and you find that you can't quite brush your hair anymore, you know, don't wait until it gets real bad and you're reaching to shake somebody's hand and you can't get your arm in the air. You know, there's help out there, and it's not always surgery, you know.
That's another thing, is that, you know, people right away think, I know they're going to do surgery. Well, I don't think there's anyone who's the biggest baby going to doctors is me. You're looking at him, okay? I fear because I'm always worried about it. So I'm the big baby. However, and I admire women because I think they're the strongest people in the world. They give a baby, have a birth like your wife's going to have,
yeah.
Forget about it.
Yeah.
But with that being said, sometimes if they call for a consultation, there could be methods that you don't need surgery, correct?
Right. Oh, quite frequently. You know, 9 out of 10 people who come into my office don't need surgery. You know, there's this misconception that, oh, I'm going to see a surgeon, I'm going to end up with a surgery, and that's not true. And, you know, the thing is that a lot of orthopedic surgery now is becoming more, you know, not what it used to be. You can have a knee replacement, have a private room at the coordinated health hospital, have food off a menu, have your family stay with you. You know, it's not like it used to be.
The interesting thing is, you're talking about, I was talking to someone who you did a hip replacement on. Of course, they know the fact that I know, you know, your family so well. And hey, it was your buddy Falvello. He operated on my hip. Let me tell you, and he couldn't stop bragging about how, you know, how you did. And then there was another person who did something with his shoulder, an elderly lady who you said who fell, unfortunately. Okay, scared out of her mind. You know, the family was scared of it. But you came in to the hospital. Bedside manners, Tony, are so important.
It is.
I mean,
yeah, it is, and that's a lesson I learned from a lot of the people that I trained with down at Pinnacle, and it really is important. It's about earning that patient's respect, treating them like a human being, and making sure that they understand what's wrong with them and what's going to happen to them.
Yeah, because, you know, I know you see a lot of people, and thank God you're doing extremely well as an orthopedic surgeon. But, you know, you're nervous. You don't know what's going to happen. Okay, what you don't want to, even though could be a great surgeon, what you don't want to see is a guy who comes in or a woman comes in and makes you feel like, you know, you have that bed, make me feel good about what I'm doing.
Right. I think that's important, and I try to do that whenever I can, and I think most of my patients will tell you that I do that. The old days of medicine where you got the guy in the white coat and he comes around with a clipboard and says, this is so-and-so, and there's, you know, 5 people standing behind him, and they don't even talk to the patient or treat it like a human being. There's no reason for that anymore. You know, you could do both.
And what I admire about orthopedic surgeons, you know, in your case, when you could have a very serious surgery, and you do it professionally, and then you have to see so many different people, and your personality has to always be there. I mean,
yeah.
You must come home at night and just cash right out, and Isabella says, "What's wrong, Tony?" Well, you know, I only did 50 surgeries today.
Yeah, 50. That'd be a record. But
yeah,
it is busy, and you know, I'm fortunate that it's busy. But yeah, that is sometimes tough, and you know, not every surgery is a success, but the vast majority of them are, and it's a great feeling when you see that person later and they shake your hand to thank you.
But one thing I think people should realize, okay, it's just like a pilot who gets on a plane. He ain't getting on that plane if he knows that plane is not perfect for him to fly.
Right.
Okay.
Right.
Because they figure, well, the pilot's life's at stake as well.
Right.
He's more concerned about what's happening than the people, as well as an orthopedic surgeon.
Very
I know
true.
that you're very meticulous, and you dot every I and cross every T before you do that surgery. Give me a little. Why is that? I know it's, but so the viewer knows why that's so important.
Oh, it's important because, you know, surgery isn't without its risks. Anytime you cut skin, there's a possibility of infection. Take, for example, your average patient with a rotator cuff. They come in, they've had a lot of pain in their shoulder, particularly at night. They get a lot of pain at night. And, you know, they come in and their MRI says, you know, they've got a rotator cuff tear, but it's not a big tear. You know, you can try therapy, you can try anti-inflammatories, there's injections you can do. There's all sorts of treatments you can do before you recommend surgery to that patient. If you haven't done those, then, you know, surgery may not necessarily be appropriate.
So again, as I said, folks, Dr. Tony Falvello, orthopedic surgeon, for consultation, and you do consultations, right?
Absolutely, yeah.
861-8220, located at the Coordinated Health Facility at the Churchill Mall. Falvello Orthopedics, the interesting thing again is being involved with so many doctors throughout the years, and you have a person, I don't think maybe a day or a week goes by where someone will say, you know, I watched the show and I finally decided to go, and Sammy, I was suffering all this stuff, and you know what, it's like it was a piece of cake, and
right.
I should have done this way back.
Right.
I'm sure you hear that all the time.
We do hear it all the time, and you know, I mean, there's so many patients that do wait, you know, until it's just too late. Sometimes it even becomes that nothing can be done, you know, or we see these patients that are 85, 86 years old, and who wants to undergo anything then, and by then the problem's so bad, you know, you don't have to suffer. You don't have to suffer.
They say that, you know, we mentioned before, but the longer you wait, okay, with arthritis sets in and a lot of other things. Not that there's no hope for them, but it's so much easier right now if you're having that pain.
That's a testament to the type of people that we have in this town. I mean, they're tough people here. Yeah. You know, it's not like other places, you know, where when I was doing my residency, people come in with a little bit of shoulder pain. It's been hurting me for 2 days. You know, I mean, you see some people they've been limping for 20 years. You know, I mean, it's crazy.
Now, do you slap those people in the head when they come in?
No, I try not to. I say, I give them a "Why didn't you see me sooner" kind of thing, but that's about it. You know, and it's really you know, if it's going on for a couple of weeks, even then, it's time to see a doctor. You know,
the education, which is important, but the internship, you know, what you've seen. At your right now, the way you see Falvello Orthopedics, you know, I'm sure the area could feel very comfortable that you're going to be around for a long time. I'm very happy to see that you're going to be a father pretty soon. Yeah. I told Isabella she should get prepared because she'd be 7 or 8 Falvellos running around the place.
Right. Well,
don't fall off the chair, Isabella.
Yeah, no, we already have a 14-year-old, my stepson. I've been really involved with him in sports and baseball, and that's been really enjoyable for me. And he likes the area too. So yeah, it's been great.
And you've been busy.
Healthy. Been very busy. Yeah, we keep very busy, and you know, it's hard to pay attention to every patient and see them all, you know, but we do the best we can. So.
Well, you're doing a great job at it. The point is, you know, if I need that particular, if I'm suffering with pain, I should come and see Tony Falvello. Now, we're doing a show today, and primarily the show is to educate. And one of the things you've been involved with, and very involved with, is giving seminars. Okay, and these seminars are important. Okay, let's talk about the events that you're involved in.
Okay. Well, I have a seminar coming up on August 20th. It's going to be at the Coordinated Health Campus, and we'll be talking about prevention and treatment of sports injuries. And in this area, we're talking about all age groups, the pediatric patient right up to the adult, the weekend warrior. You know, we don't have too many professional athletes here, but you know, we certainly have a lot of people involved with sports. And on this year, I'm also going to be working with the Hazleton Area School District, and I'll be working on the sidelines at the football game and helping the football team, which is a real honor because, you know, years ago I was a part of that. Yeah. It's that's
fantastic.
Yeah, that'll be fun. That'll be a lot of fun.
So now, if I'm playing football, you know, there's a great orthopedic surgeon on the sidelines.
Yeah. And
no coaching now. Just stay there.
No, you wouldn't want me to coach. I don't know anything about football, but
just take care of orthopedic situation.
That's right. Yeah, basketball, baseball, all the other sports. I hope to help out with those too. But you know, whatever the school district needs, I'd like to be a help to them.
So sports medicine, that's really big these days, right?
It is, absolutely, yeah. And the training that you can get goes, you know, pretty far. And sports is one of the most evolving fields of orthopedics. When do we do what? What does the literature show? And, you know, there's so many common injuries that the treatments are still evolving for. You know, it's important to keep up to date with that kind of information. So.
The average age, folks, if you just tuned in, you're watching the Sam Lesante Show. My guest is Dr. Tony Falvello, orthopedic surgeon. For any kind of, if you want consultations, 861-8220. Falvello Orthopedics is located at the Coordinated Health campus down in Churchill Mall. Now, Tony, when I have, take me through this, okay? I'm having rotator cuff, or I'm having shoulder problems, okay? And I know it will be a little redundant here, but some people who just tuned in. So I call you for consultation. What's the process then?
The process is usually...
As your father says, process.
Right, that's right.
Yeah. I got to correct myself. Sammy, will you speak correctly when you're talking to my son?
It's pretty simple. You know, of course, insurance dictates so much of what happens in medicine today. But you know, if you don't need a referral, you can come right in. We'll set you up for an appointment. And one of the things that we try and do, and we've been pretty good at, is not making people wait. You know, there's not a 3-month wait to get in to see me. We have lots of office hour time available, and we try and get you in within a couple days to a week if we can. The other thing is that you can walk in. You know, at Coordinated Health, you know, sometimes you can walk in and see me. They also have a care on demand, which is like an urgent care. So if you couldn't see me that day, or if I was in surgery, at least you could, you know, see a physician's assistant who's skilled in orthopedics, and then get set up for an appointment soon with me and get the care that you need. So that's a great opportunity that they have there.
So you could take me from start to finish.
Yeah. Yeah.
Okay, so you know, let's assume that you know you could have a consultation. You do what you have to do, and say, okay, you do need rotator cuff or hip or whatever. Then my rehabilitation. Okay,
right.
What's the process after that?
Well, the rehabilitation is a big part of anything in orthopedics, and I always tell my patients, hey, listen, I'm just the carpenter, okay? You know, I'm glad you're doing well, but give yourself some credit, you know, to the patient when they do well, because physical therapy and rehab is half the process. And
be careful.
Sorry. Yeah. And so we do offer that at Coordinated Health, and there are a lot of other great physical therapists. There's great therapy in this area as well. So you know, nothing to shy away from there. But after I usually get a treatment plan organized, you come in, you got your rotator cuff. Let's say it's a small tear. You go through therapy, you get your injections, and you're just not making progress. Well, unfortunately, then surgery becomes indicated. We do the surgery. I fix the rotator cuff and take care of you know, some of the other things I might find in the shoulder. Then it's the patient's job. Start your rehab. And in a rotator cuff, if it's a bad tear, it could be 6 months to a year. Usually it's about 2 to 3 months of rehab. So.
And you monitor that as they're coming in?
Absolutely,
Okay.
yeah. We follow you right through till the end, you know, until the patient comes in and says, you know, I feel good. And then I say, well, you know, do you think you need to come back? Are you doing well?
Okay. We talk about the spine, okay, and that's always such a critical situation. And I don't know. I remember growing up, you know, if someone had someone with spine, please don't go for surgery. You know,
right.
That's the worst thing you want to do is get surgery, suffer the pain.
Right.
Again, there's always a risk. We're not going to say there's no risk, but how much is that? You know, now where a person who does have spinal problems, if they come to you, okay. How much of a problem is that today as far as risk factors?
Well, it all depends. You know, certain what we call comorbidities change your risk factors. You know, if you're diabetic, then your risks are a little higher in spine surgery and in orthopedic surgery in general. But you know, there's a lot of things that can be done for the spine that are not, you know, surgery, and the non-operative treatments really don't have much risk at all. You know, very, very low risk. And you know, like chiropractics, like Dr. Palermo's on the Coordinated Health campus now, you know, and he's very good at treating a lot of these conditions. You know, those things are beneficial. They are helpful.
You've actually participated in spinal surgeries.
Oh, many, yeah, many as a resident. I haven't done too many here in Hazleton because, you know, there's a certain resources we don't have. You know, technology that's not yet available here.
But at least you could see me.
Yeah, but I can tell you what you need. If it's something I can't do, that's the one thing. I don't jump into situations where, you know, I feel uncomfortable. If I think you need something that I can't provide, then I'm going to get you to the right person.
I don't think Tony Falvello would do anything just like your father as an attorney. He would never take any case if he didn't feel it was worthwhile. I don't think you would go into surgery or cut anybody unless you knew you had a great shot at what you're doing.
That's absolutely true. It's a huge responsibility putting a scalpel or a knife to somebody's skin, and I take that very seriously.
And it is, because you know, people are just putting their faith in you. Now, you have future shows that we'll be talking about, but you also have other topics. And what are some of the other topics that we'll be talking about?
Well, I like to do a lot of the so-called bread and butter of orthopedic stuff. So, rotator cuff is a big one. Carpal tunnel. One thing that we see a lot of here is osteoporosis and hip fractures.
Yes.
Prevention of hip fractures is so important to the
there is a process
aging population here. Yeah.
Prevention of hip fractures.
Yeah, prevention, because by the time the hip fractures, it's too late. You need surgery.
What are some of the things that to prevent from hip
Well, there's
fractures?
different medications, simple exercises that can be done. Light weight-bearing exercises can help you build bone. There's new medications that not a lot of people know about now that are actually showing to somewhat reverse osteoporosis, where in the last 20 years, most all of the medications have just slowed the progress of it. And so there's a lot of things to talk about there.
That's interesting.
Yeah,
Okay.
yeah.
And this reversal, okay, there's certain medication out there?
There's one out there, and it's expensive and it's difficult to get paid for through insurance. But yeah, it does show actually improvement in the density of the bone structure. It's really rather impressive.
Don't you? Now, if I was a medical doctor today or a surgeon, I would be totally frustrated with the insurances, etc., because you have the cures out there.
Yes.
Okay. And they're supposed to be saying preventative medicine. Well, you really want to see that person be prevented, because a hip surgery is a lot more expensive than
Absolutely. I mean, the average hip fracture, if you have a prosthesis replacement, you're talking probably $20,000 plus cost to the insurance system, if not longer than that. Much more than that if you look long term.
Well, don't you think you'd want to be able to promote the fact that you have medicine to do that? I mean,
it's counterintuitive. There's a lot of things. There's a lot of things in medicine when it comes to insurance that don't make sense.
Your dad and I have these shows, okay, and it's totally frustrating, and it's a shame. And what I fear, Tony, is, as you said, in the areas that we're covering, northeastern Pennsylvania, there's a high senior group, okay? I'm just hoping that with the healthcare laws, from what Dr. Greco has said, where they're going to tell people who are over 70, 75, well, no, you can't have that hip surgery.
Scary. That's
it's
scary.
And people don't realize that.
I know.
That's very scary.
Yeah. The government could write you off, as unfortunately they do in some other companies or countries. I'm sorry, and just say, you've had a great life. It's your time.
I mean, that's pitiful.
It really does happen. Yeah.
But anyway, so far, Tony Falvello, orthopedic surgeon, Falvello Orthopedics. I'm very proud of you, Tony.
Thank you. I'm
very proud of you,
as
well as I am with all your family. But your sisters, your family has just been good, and they do things from their heart. They've never ripped anybody off. They've always been there to help people, and that's a tribute to your mom and dad and your grandfather, especially my buddy Tony.
Yeah, thank you.
You were named after my buddy.
I was, yeah, my namesake, my grandfather. He was a great man. Very proud of him and my entire family.
Yeah. Now, what are we looking forward to the next Sam Lesante show? Or maybe we're going to have your own. I think we should come up. Isabella, your assignment is to come up with a great name here for this show, because I think you'll do well. I have a producer here, folks. Isabella is the producer. What are some of the things we could be looking forward to, for educational reasons with Falvello Orthopedics?
I think we're going to try and gear it towards the seasons and how things happen, so we'll do maybe like football-related and fall sports-related injuries coming up. And, we'll branch out with some other topics, work-related injuries. And, the osteoporosis, as the winter comes, people slip and fall, unfortunately. That'd be a good topic then. And certainly hip and knee replacement and arthritis, big part of what I do.
Folks, remember this. You certainly can call in your questions, okay? My email is sam@ssptv.com. And do you have an email?
Yeah, actually, well, not one for the practice, but we're working on it. Yeah.
Well, right now, for the next show, folks, I know there's a lot of questions out there, but I hope you don't mind, Isabella. We should get some questions in it. I just threw this at them, but the point is, sam@ssptv.com. Call in your questions you'd like to ask the good doctor. But however, for consultations, I highly recommend you give them a call, 861-8220, Falvello Orthopedics, located at Coordinated Health. On the Churchill campus, there for you, on call at a time. Anything else you want to say, good doc?
No, thanks for having me. Appreciate it very much. Yeah.
It's nice seeing Isabella. Maybe when do we do? Thanksgiving Day, folks. We're having a big party at Falvello's house. Connie Falvello is throwing a big party for everybody because they'll have a beautiful baby. I think she may be having twins, but we don't know that. Okay.
Yeah.
You're watching the Sam Lesante Show. Remember, 861-8220 Falvello Orthopedics. Give them a call if you need it. Okay, we'll see you next time.